Hi, this is Dr. David Zahlauk, and I wanted to give you an update on how to prevent and treat colds and flus in the winter months. We're just getting over a flu season, but there's still a lot of things going around. You know, the number one thing you can do to prevent getting sick any time of year is hand washing. Most of the germs, upper respiratory germs that are commonly spread, happen when someone coughs or sneezes on their hands, or they rub their nose or mouth on their hands, and then they shake hands with you. So maybe one of the best things you could do would be to not shake hands. I don't know if you will bow or curtsy or fist pump people or what you want to do, but see if you can avoid that. I know it's a social custom. When you do wash your hands, I want you to soak your hands, get them real wet with soap and water all the way up to the wrists, and take about at least 15 to 30 seconds to clean them, and then towel dry them once. It's really important though that you do that frequently, especially before eating, after you've coughed or sneezed, if you touch an animal, or of course if you're around somebody who's sick. Now, what else can you do in terms of vitamins and minerals and so forth? Well, here's a review from the literature of what works and maybe what doesn't. Vitamin C seems to help. You have to take at least 500 milligrams daily. Some people take it in forms like emergency or airborne. I like airborne because there's magnesium and zinc in there that are also good for your immune system. But it seems to help, especially if you're exposed to the cold a lot. Vitamin D, there was a study done in nursing home patients who got vitamin D, and they seemed to get sick a little bit less. So it reduced the chance of them catching something. In this, nursing home environments is when an infection just spreads through like wildfire, essentially. It's also good to know that vitamin D helps to prevent osteoporosis and colon cancer and heart disease. So we check our patients once a year to get their vitamin D levels checked, and it's about 20% of people who are low in vitamin D. Vitamin E, there's been studies looking at the effectiveness there again, and it causes a modest reduction in incidence of the common cold. Further studies are being done to kind of confirm this benefit, so it may help a little bit, not a lot. The thing you need to know about vitamin E is not to overdo it. We used to commonly, about 10-15 years ago, recommend high-dose vitamin E, 400 or 800 units a day, to help to prevent heart attacks and strokes because it has antioxidant properties. But it turns out that prolonged high-strength use will increase your risk of getting lung cancer. So 200 units a day maximum for this. Echinacea is used commonly. It's the most commonly used botanical in the hope of preventing upper respiratory infections. The data, though, don't support that it helps. It's probably not going to hurt you, but there's no evidence that it helps. Garlic probably does help. The studies are not that well designed, but it does help to prevent getting colds and flus. Plus, it's good for your heart because it opens up your blood vessels. North American ginseng will shorten the duration of a cold or a flu when you take it preventatively, but it doesn't really affect the severity of it, but it might shorten it down a little bit. But again, hand washing is number one. So that's the update. These are things you can and should be doing to stay healthy, especially in the winter months or maybe all year long. Thank you.